Good morning. This show is sponsored and brought to you by the Southern Nevada Health District. I am your host, Elisa Howard. I am a public health educator and consultant and owner of Minority Health Consultants. You are listening to Public Health, Just the Facts. With this show, we want to set the record straight for Southern Nevadans as it relates to all things public health. For more information, you can visit snhd.org. Good morning. We have a great show for you today, along with some great guests. Today, we're going to talk about Black mental health and doulas, and we're also going to talk about Alcohol Awareness Month. This show, we want to highlight these two different annual awareness days, and we have some great guests in the studio with us to speak about these things. First, we have Tiara Flynn of...
Hi, my name's Tiara Flynn. I am the founder of Phenomenal Mama LLC.
That's a cute name. I like that.
Thank you.
And we have Anna Marie Hernandez and Ron Schneese. Did I say that correctly, Ron?
Not even close.
Say it for me.
Ron Schneese.
Schneese. Okay. Yes. It's very fancy. All right.
I'm a Polish.
Just like Ron, he's very fancy.
He's very fancy. Okay. I love that. And so will our guests. And they are from Foundation for Recovery.
Yes.
I sit on the board with your fantastic CEO, Sean.
Yes, Sean O'Donnell is amazing.
Yes, he's amazing. I'm glad that he sent you all. I said, Sean, I need some people. He said, and he connected me with you all, so I appreciate that. We do want to jump right into this show, and we're going to also provide you with some current local updates to protect your family through our Arm in Arm Against COVID-19 updates, because we always have to bring that up because COVID is still a thing, people. It's not gone. So Tiara, fancy having you on the show with all the things that you do.
I'm so happy to be here.
Yes. Tell us about your work and the things that you do.
Okay, so I know you know me from other circles, but today I'm here wearing my doula hat. As I said, I'm the founder of Phenomenal Mama LLC. I am a full spectrum birth doula, which means I'm a trained professional, non-medical. I have to point that out, for physical, emotional, and informational support to pregnant people and their families throughout their birthing journey and beyond.
Wow. So you and I were having a conversation earlier before we started talking about this on the air. I want to kind of go back into all of those things because
of course.
I learned so much just in that casual conversation about birth doulas. I sit on the Nevada Certification Board where we certify birth doulas.
Yeah.
The state of Nevada actually came to us from the Medicaid department and said, we need this certification to live somewhere.
Right, exactly.
And as a board, we were like, well, we never thought about birth doulas. We certify peer support specialists and community health workers. Yeah. And so birth doulas was going to be a totally different realm for us. So we also had to do our research to find out, is this something that we want to put our stamp on? So can you tell us what a birth doula is?
So a birth doula, like I said, is a non-medical professional that is there to support mostly the pregnant person through their entire journey. So if you're lucky, you'll get with a client from the very beginning, help them establish their birth plan, create their birth space for them. Like what I like to say is, how do you envision your birth experience going? And let's just write all that down. And then medically, you take all those questions and, talk to your care provider, your OBGYN, and say what's possible. Can you have a water birth at home? Can you do vaginally in the hospital? Like what's possible for you? Birth doulas are around, one of the oldest professions, like midwives, which are completely separate, because everyone in the situation is focused on the health of the baby, really. And so somebody needed to be there to support the mom, like physically, emotionally, just in any way that we could. And like I said, it's pre, post, during, we're there. We're there more than anybody, really, with the mom. So,
and that's a great thing to do as far as being there for the mom, because the mom is the one that's doing all of the work, right?
The work. But then, when the baby comes out, it's like, oh, the baby's so cute.
Right. Forget mama.
I'm coming to see the baby. Like everybody forgets about mom. So like even in your postpartum work as a doula, you go over to help mom with whatever, you put in your scope of work. You could be doing dishes. You could be helping them pick up around the house. You could be bringing prepped meals. I mean, if you're a cook, I'm not that type of doula. Maybe I'll link up with somebody at some point to do prepped meals, but I'm not. You don't want my cooking, so.
That's funny.
I can DoorDash you.
I can DoorDash you.
Yeah, whatever they need, I'm there.
But when you say non-medical, what exactly does that mean in the room with the mother?
Yeah, so like we were talking about offline, most doulas will seek other types of certification. Like for me, I'm currently in school to become a certified medical assistant because I just don't like things happening around me. I want to be able to provide that additional comfort for my clients, and most doulas will do the same. They'll go seek CPR training. But doula training or certification is not currently regulated. So you can go and get your initial training, which consists of a course, usually like 2-3 days, where you learn about how to support them, like I said, emotionally. And then after that, you do a childbirth education class and you're good to go. Or you can. I was in training with someone when I first started in 2019. She had been a doula for 25 years. And she's like, I never did any formalized training. This is just something that I naturally was doing. Same with midwives at one point.
At one point.
Yeah.
Like they show in the different shows they're showing now.
Movies and all that stuff. Like, it's just something that I always read from, I forget her name now, of course. But anyway, the process of birth used to be called in the family way. They didn't even call it like pregnancy or birthing. It was in the family way, where actually all the men had to leave the home. And it's just the midwife comes in with they didn't call it doula at the time, but support people. Right. So it got a name later on. And that was it. Everybody's in there for a reason. Everybody in the room is there to support the mom and the baby.
Okay. And do we know where the word or the term doula even came from?
I know what it means. I don't know when it came about, but it's like of Greek, and it means to serve or servant.
Serve. Yeah. I love that.
Yeah.
Okay.
Yeah.
I've learned a lot, and I know our other guests have learned a lot. Their faces.
I know. I could talk about it for like days and hours and hours.
But that just means that you're passionate about something, right?
Yeah. It feels natural.
Yeah. And the fact that you said that you all could do this work without any certifications or any, formalized trainings before, it reminds me a lot of community health work.
Yeah.
It's the same exact thing. It's like we're already out in the community doing the work where people like at the churches volunteering.
Exactly.
You're already doing something for your community health-wise.
Exactly.
You're maybe giving some education and some information, and now we finally have a certification for community health workers and for birth doulas.
For birth doulas, yeah.
So thank you for all that you do.
Of course.
And so I wanted to bring in our other guests so that we can bring them into this conversation, so you're not just sitting over there. And Maria Hernandez and Ron, I'm not going to even try to.
Okay.
Can you just brief introduction of yourselves and Foundation for Recovery and what you all do there?
Yeah, go ahead.
Thank you. So my name is Anna Maria, and Ron and I are part of Foundation for Recovery, which is a nonprofit where we help people seeking and in recovery throughout their recovery process and journey. So we do a lot of different things, but what's really special about it is that all of our services are peer-driven, meaning that they come from people that have that lived experience, that have struggled with mental health and substance use challenges in the past, are now in recovery and want to help other people experience that same health and happiness that they have found. So it's a great organization, and all of our services are amazing.
And Ron?
Well, like Anna Maria said, Foundation for Recovery, we offer all of our services for free. They are, because we're entirely grant funded. We truly believe in serving, the substance use and mental challenge population. So I actually am a certified peer support specialist through the certification board, and I have lived experience. I was in my I was lost in my addiction and my mental health challenges for over 20 years. About 7 years ago, I, finally had my last run. Ended up in prison. At prison, finally had enough and made my changes. Was diagnosed HIV positive. Just all this confluence of things came down to where I was like, this is not where I saw my life ending up. And as I got into recovery, got into working in the field of treatment, and then found this amazing organization and went from the private sector to nonprofit, because the amount of work we can do at the community level, on the ground, outreach events, stuff like that. Just let people know that these services are here. We can help them navigate recovery. We can help get them connected to a support network that they design. Much like you were saying, they design their home birth, we help them design their recovery pathway.
Wow. And that's special, right? Because then they feel like they're a part of the process.
Well, and they have to be, because it's their process.
It's their process,
So,
right?
Yes, too many times organizations try and take over and tell you exactly what they think you need to do, which there is evidence to support that reasoning, but it still makes you feel like you've been taken out of the equation.
Right. Like someone is telling you what your plan needs to be to help you get back to your life. And you're like, this is my life?
Yeah.
Right.
Exactly.
I could talk to you for hours, Ron, because you have such that background. How many people do you meet like that have come out of all of that and you're now giving back to other people? So that's that peer support model that a lot of people don't know about. A lot of people don't know that they can actually get a job and get certification in what they've been through.
Absolutely. That's I'm so blessed and grateful to be able to have turned my checkered, my dark history of a past in criminal history and mental health challenges into a career.
Right.
It's
Yeah.
amazing.
Yeah, last month we had someone on, Dr. Sheldon Jacobs from, he actually runs his own office called Dr. Sheldon Jacobs about mental health, and I know he does a lot of work with peer support specialists as well. So that mental health piece just kind of made me think about that because that is included in everything that we do, right? When I was in HIV, we had to learn about mental health because it segues, right? When we working with peer support specialists in HIV. So everything kind of intertwines and intersects with each other as far as health is concerned. And I'm just kind of glad that you brought up all of those things that you went through because it's all connected.
Intersectionality, and everybody has had their own experiences. That's important and integral to finding their pathway.
Exactly. I wanted to see how these two subjects intertwine and intersect. As we talk about Alcohol Awareness Month and Black maternal health, have we found any correlation between the two of these? As far as we know that Black maternal health is a topic that we talk about often in public health because Black women are treated disproportionately treated wrongly. Their babies are treated wrongly when they're giving birth, just the process of the birth, and then alcohol awareness. And how do we marry those two just with statistics from, is there any kind of correlation, not between those two specifically, but just alcohol awareness and in the Black community?
Yeah.
Yeah, absolutely. So in 2018, according to the survey on drugs use and health, it was found that 6.9% of the African Americans have a substance use disorder. Something that is crazy is that 3.4% of them reported using illicit drugs in the last month.
Wow.
Whenever the survey was conducted.
Oh.
Right? It nudges that, but just like you were mentioning, that Black moms have been treated disproportionately worse in healthcare setting. The same thing kind of happens in recovery, right? Not as many people in the Black community seek out recovery because of the stigma associated with it. So then Black moms have the double stigma of being a Black woman on top of also being a person that has substance use disorder, which leaves them feeling like they are not worthy of help. They're not worthy of seeking help, which prevents them from actually going to foundations like Foundation for Recovery or to their doctor or somewhere to seek help just because they don't feel like they're worthy of that.
Yeah. Yeah, and like Anna Marie was saying, it starts from when you're pregnant and you get mistreated or there's that structural racism that you experience. So of course in their postpartum recovery, they're not going to seek out third-party help because they had all these issues when they were pregnant, being dismissed or mistreated. Like you were asking, Alyssa, the United States has the highest mortality rate for Black women. And we are one of the most, of course, technological advanced countries in the world. So, that doesn't really pair up well. And just in 2018, the U.S. recorded 17 maternal deaths per 100,000 lives, and those were Black women. Black women are 2 to 3 times more likely to die giving birth or immediate postpartum than white women. And so, we immediately slip into that postpartum and depression and turn to things like substance abuse and alcoholism and things like that.
And I think the person that brought this to the attention of just everybody is Serena Williams, right?
Yeah, she was one of the people for sure that said, I'm on this level. I have this amount of money and I'm still getting treated this way. And like we were talking about offline, I'm like, I wasn't even a stranger. This is kind of one of the things that rolled me into being a birth doula. because I experienced the same thing. I have really bad asthma, and so I've been turned away in ERs, like, oh, okay, well, you'll be fine if you don't want to wait for a respiratory therapist. And even while I was pregnant, fortunately enough, I had a black nurse, and she was just incredible with my first kid. So,
and that makes such a big difference, right?
It made a huge difference. I felt like I could trust her. I didn't even know my OB, honestly. Like, I went to her for appointments, but I didn't feel like we knew each other. So that's where that support person would come in handy. At the time, I didn't know what a doula was, but I wish I would have had one with my first pregnancy. Luckily, I had that nurse who listened to me, who respected. I did have a birth plan. I built out my own. It's as simple as going on Google and writing down your desires. And she respected me and she listened to me.
I mean, how important that is, right?
Yes.
I mean, just equity in general. And that's what we talk about as we talk about just the facts in public health, is health equity is so important to bring that in for people to feel comfortable, right? And for them to see that someone looks like them and you get it.
Right.
And so you know that person's going to take care of you because they get it. That's what health equity is, and so many other things. And as we transition over back to Anna and Ron, I wanted to talk about what are the effects of alcohol in the body. As this is a show about education and information, we want to also let people know why we're even highlighting Alcohol Awareness Month, right? What are the effects on the body when taking substance use, opiates and alcohol and things of that nature, all that you all work with, right? What are the effects?
Okay, well, I'm glad you asked that. I do want to circle back real quick to one of my passion things is cultural competency, and the hiring process is 4 places. You had a black nurse, so you definitely identified more closely with her, felt you could talk to her more. Cultural competency here in Nevada is actually a little better than I've seen in other places in the country regarding substance use, mental health challenges. There is a wide, diverse range of providers out there where you can get connected to. That's part of where FFR comes in, Foundation for Recovery comes in, is connecting people to resources that they actually will use. Some of the effect, but to circle back to the effects, some of the effects alcohol has on the body and other substances would be depression, mental health challenges. Already, let's just say it. Alcohol isn't the problem. It isn't. Alcohol is a coping mechanism dealing with something much deeper. Like you were talking about postpartum depression, 10 to 15% U.S. women experience major postpartum depression. Depression symptoms in the African American community have been as high as 35%. That's a very high number.
That's very high.
And that's almost double, triple, So these are emotions, feelings that we might not know how to deal with, on our own basis. We don't reach out to the community members because we want to keep those strong. I can do this. I can bear the weight of the world on my shoulder, It's all a facade. Everybody needs help. And if you can build your community supports with people around you that understand what you're going through, like you did with your birthing, it makes all the difference in the world. Some of the physical complaints or physical things that can happen with alcohol and other substances, other than contracting various diseases, like I contracted HIV through my intravenous drug use, kidney disease, stomach issues, stomach cancers, it can affect pretty much any major organ in your body. Your heart, oh my goodness, your heart can be severely affected by alcohol use. It's a depressant. It can slow things down. Some of the things that happen with fetal alcohol syndrome, and speaking in terms of motherhood, fetal alcohol syndrome is very prevalent with women who consume alcohol regularly through their pregnancy. That can cause stuff like learning disorders, learning disability. The circumference of the head can be smaller than normal. It can cause internal organs not to develop correctly.
Wow.
Low birth weight, preterm births.
Wow. So many things, so many effects, right? Mentally, emotionally, it sounds like, and then, of course, physically. Thank you for that. I did not know a lot of those statistics. I mean, there's so many topics in public health, right? But you can learn so many things, and there's, it's all in your head. But when you actually sit with people who do this work every single day, it definitely brings all of that back up, and you're like, wow, just that correlation between those. I wanted to ask Tiara really quickly, do you have any tips for people who want to become a birth doula? Like someone that's just, hey, I've been interested in that, but I didn't know it was a real thing.
Yeah.
Do you have any tips or resources?
Yeah. First thing is just like research what type of doula you want to be. Tapping into what aligns with you, because there are several different options for programs, and I wish I could, but I don't push one over the other specifically. But just figuring out what aligns with you. I think what we were talking about before we start recording, the program that I chose, I felt like included everything that I was, that I want, that represents me, that I'm an ally to, and that I feel like I'm going to be an advocate for eventually. And so you just have to figure out why are you getting into birth work, and you'll find the program. There are a lot of programs. Like we said, it's not certification isn't regulated. So you just have to pick what aligns with your personal beliefs or the community that you're going to serve. I shouldn't say your personal beliefs, but the community that you're about to serve, find a program that aligns with that.
With what you want to see, how
exactly.
you want to. I get it. And again, for that, if you are looking into becoming a birth doula, you can contact Tiara at
thephenomenalmama.com. And you'll learn how to spell phenomenal. When I chose the name, I was like, why did I do that to myself?
It is a tricky word.
It is, and now I got it. I got it down.
That's funny. And then after you do that and you go through some trainings, come to us at the Nevada Certification Board,
yes,
and we can get you certified in that. And then Ron and Anna Maria, do either of you have any tips and resources that someone out there can use right now if they are suffering from alcohol addiction?
Absolutely. I think that the first thing that I would say is to feel comfortable to come to Foundation for Recovery and either give us a call and just speak with one of our peers. Speak with someone who has been in those same shoes in the past, right? And has been able to come out of it and just have a conversation about what your goals are, about what it is that you're looking for out of your recovery, and let us help you make a plan for it.
I love that. I love that. You all sound very welcoming. Ron, do you have any?
Just to, try your best to get over your internal fears and seek help. Open your mouth. Closed mouth doesn't get fed. Open your mouth and reach out. Come to Foundation for Recovery. Even just come for one of the many support meetings that we have going on there during the day. Talk to a peer support specialist. If it feels more comfortable talking to somebody that you don't know, we are a good fit for that. If you feel like you need to reach out to your family, come talk to us first so we can talk to you about ways where you can address it with your own family. Because believe me, a lot of us think we're hiding it pretty well, but our families know.
They know.
They know.
Yeah. If I could really, really quick.
Yes.
I want to add the biggest tip for families and pregnant people and expecting, whether you hire a doula or not, create a birth plan. Just create a birth plan, because that'll get you on the track to asking your doctor or your healthcare provider, your OBGYN, the right questions. You need to understand that it's your birth plan, your birth experience to create, and they work for you. That's what I tell my family.
And we always talk about how we don't get to be involved in our
exactly.
stuff. This is our perfect way to be involved in our addiction plan, right? But also our birth plan, our Black maternal birth plan, right?
Yes.
So this is a way to get
Over
involved.
our own bodies. And our
Yes.
To be in control.
It's crazy that people don't feel that way. I think because doctors went to school forever and they get all this money, but listen, it's your body.
Exactly. They have a God complex.
Exactly. It's your body at the end of the day. I love that.
Yes. And I love that. I really appreciate all of you being on. This is such a fun show for me because I got to learn. I love learning. I'm a nerd. I got to learn some stats, and I got to learn just some things that I did not know fully because, like I said, public health encompasses so many different subjects, and so I kind of try to stay in my lane. But I'm glad to have people around me that do know these topics, and you all study these things. So I appreciate you all being on. And we are going to transition over to our arm in arm against COVID-19 because there is still a pandemic out there, people. So as we transition over to our Arm in Arm against COVID-19, Arm in Arm is a collaboration formed by the local agencies Brain Trust, Some New Marketing, and Erica Aviles Consulting in partnership with the Southern Nevada Health District. This initiative is our community's chance to come together to share information, community resources, and have enlightened discussions. Today I have with me Xavier Foster from the Southern Nevada Health District, and I thought it would be great for him to come on and talk about our arm in arm instead of me doing it. So Xavier, tell us your name and just the department you work for, or the department you actually run. My bad.
My name is Xavier Foster. My job title is Health Equity Coordinator at the Southern Nevada Health District.
And I just want to say that he's going to get me, you guys. He was not here for this, and I brought him in, and he's staring at me right now. So I just wanted to bring up really quickly COVID-19 and how it's not gone, right? What has the health district seen in this era as we have taken off the mask mandates in a lot of states?
Yeah, it's interesting you brought that up. Right after the governors taking the mask mandate away, we saw a large decrease on individuals accessing our testing site at the district.
Yeah, I remember coming to the health district about in December, and the lines were crazy. I mean, I couldn't even find a park. And so you said they went from like 150 people, right, being in line to what?
To 2 or 3. I remember getting into the office at 6:45, and you will see people getting there already to get in line to get tested. And since the mandate was taken away, I mean, you can go by the testing site and see nobody accessing that.
And I just want to bring this up to the listeners that there is still a pandemic out there, you all. And as we talk to the Black community, especially with this being on KCEP, with Xavier being here and from the Health Equity program, it's just really important to me that we save our lives, right? It's really important that the Black community understands that there is still a pandemic, meaning there is still a virus. It has not turned into an endemic where it's just gone and it's just prevalent in the community, like the flu, right? Where it comes around seasonally. It's still here and people are still getting sick. I actually, a family friend, his sister just passed from COVID. She was older. She was in her, I believe, her 60s. But not even from an age perspective, we think that, it's, only affecting this age group. But there's been young people who have passed from this as well. And so from a health equity perspective, Xavier, what has your office been doing?
So pretty simple. Equity to me means providing the resources and the opportunities for people to get to positive outcomes. As it relates to my job, it would be definitely positive health outcomes. So as a program, through some CDC funding and community collaborations, what we did was to reduce or remove barriers for access when it came to COVID resources in the community. So whether they be working with community organizations and going into the actual communities to make sure that transportation is not an issue for people to come and access the resources, whether it be simplifying the process of coming to get a shot or get tested because you don't have internet access to be able to make an appointment. So kind of removing those barriers or to make it as easy as possible for people to come and get the resources or the services that they need.
And your department is fairly new, correct?
That is correct. The Health Equity Program has been at the Health District around a year and a half. Through some CDC funding, we were able to amplify the staff. So it's currently myself and 3 health educators.
I think that's really important. I'm sorry, I keep saying department. I think I'm speaking it into existence.
Let's hope so.
So yes, I just wanted to highlight that there is a health equity program at the Southern Nevada Health District working on COVID-19. Clinics getting into the community and bringing health information and education to Black communities and to communities that are marginalized and disproportionately affected, not just by COVID-19, but by so many other things, right? I know I work with you all a lot as far as setting up vaccination clinics. And so I just wanted to highlight that because a lot of people may not know. And so that's what this program is all about, is just bringing information and education to the Black community. Thank you for coming on, Xavier. Well, thank you for allowing me to force you on. I really appreciate it. And as we wrap up, I just want to thank my guests for listening to Public Health Just the Facts. Thank you all for tuning in.